Today's podcast is brought to you by Isoway Sports, the sports range for athletes looking for supplements that are free from all artificial colours, flavours, sweeteners and added fructose. Intense physical training programs place significantly higher nutritional demands on sports people, and Isoway Sports are committed to providing pure nutritional ingredients that are truly complementary to a healthy, active lifestyle. You can visit isowaysports.com.au for more information. This is FX Medicine, and I'm Andrew Whitfield Cook. And with me in the studio today is Belinda Reynolds, our illustrious senior presenter at Bioceuticals, who's a fantastic presenter of seminars. But she's also got street cred. She's a dietitian of many years' experience. And we're here today discussing calcium-D-glucarate. Welcome, Belinda. How are you?
I'm great, thanks, Andrew. Thank you for having me.
Now, calcium-D-glucarate.
Yes.
I remember many, many years ago, but it was something we never could have. Mm-hmm. This is quite exciting. What's happening?
Yes, it's quite exciting that we now have it available. It's still not a TGA-approved supplement, so therefore it can't be in an Ost-L product or in a tablet or a capsule. However, it can be sold as a product for compounding or as an extemporaneous product, which is fantastic because it can be used in good high dosages, which are then very beneficial for the patients it's prescribed for.
But what is calcium-D-glucarate? What's this about?
So calcium-D-glucarate, one of its main actions is that it is able to inhibit the enzyme beta-glucuronidase. And beta-glucuronidase, when levels are high, it causes the deconjugation of toxins away from the glucuronide conjugate it had been bound to during the detoxification process. And that cleaving of that bond that the beta-glucuronidase is responsible for can result in reabsorption or recirculation of toxins which would normally be bound for excretion. So to explain that in another way, normally when certain toxins or unwanted hormones such as estrogens in the body are required to be excreted, they go through phase 2 liver detoxification after phase 1. And during that process, that toxin or hormone is bound to a conjugate. And in certain situations, such as the ones that we're talking about, it's glucuronic acid or a glucuronide that it's bound to. This is normally excreted as a compound. What can happen is that when you have these high levels of the beta-glucuronidase, it cleaves that bond, and then that toxin again is rendered free to be recirculated. So by being able to suppress this enzyme, we can ensure healthy excretion of certain unwanted compounds from the body.
But when we're talking about detoxification processes, we normally attribute those to the wellness and the processes of the liver. But this isn't necessarily the case with beta-glucuronidase, is it?
No. So, of course, the health of the liver is incredibly important, first of all, because it's a major site for a lot of the conjugation reactions and a lot of the detoxification reactions. However, there's a number of other factors which must be working effectively to ensure sufficient and healthy excretion of unwanted things from the body. So when we're talking about the beta-glucuronidase, there's a number of areas in the body that we find this enzyme. And when you have elevated levels of the enzyme in these areas of the body, this can contribute to problems. So, for example, beta-glucuronidase is produced by the brush border in the gut, but also by potentially harmful microorganisms. So if an individual has dysbiosis, this can contribute to elevated levels of beta-glucuronidase. The result of that is that normally if a conjugated toxin is released from the liver via the bile. It enters the bowel for ultimate excretion. If you have dysbiosis and therefore that high level of beta-glucuronidase, it is in this area that deconjugation or that cleaving of the toxin away from the glucuronide occurs. And that's when you get that estrogen or other potential carcinogen rendered free and available to potentially be reabsorbed back into the body. So when we do talk about using calcium-D-glucarate to ensure healthy excretion of estrogens and other toxins, it's important to also take into account the health of the bowel. We need to ensure that there's not the presence of dysbiosis, which can cause that elevation in beta-glucuronidase. We also need to ensure good gut integrity, which will minimize both the initial exposure of the body to toxins, but also will ensure a good, solid area for that excretion process to happen and prevent reabsorption of toxins. What we also know is that beta-glucuronidase doesn't just exist in the gastrointestinal tract. It's also found in areas such as the lungs. And we also know too that because when the toxin is conjugated during that glucuronidation process, that toxin is rendered hydrophilic and water soluble, whereas previously it would have been hydrophobic. And that helps that toxin to also be able to be excreted via the kidneys, so not just the liver and the bowel. And as a result, then we also need to ensure that we have low levels of beta-glucuronidase in other areas of the body, such as the serum and the lungs and the kidneys, to prevent that cleaving of those conjugates in other areas of the body.
So when you're talking about the gut-based stuff, we really are saying that calcium-D-glucarate is a great therapy, but it's used in context of the health of those tissues. So I would be thinking about things like probiotics and fibres and how we use it in diet. Is that right?
Absolutely, yeah. So definitely ensuring that healthy balance of microorganisms and good microbial diversity is very important. So a number of different probiotic species have been shown to assist in suppressing excessive beta-glucuronidase production. And then, of course, we know how important prebiotic fibres are for promoting the general health of the gut.
You know, one of the best papers that I ever read on detoxification with probiotics, and I'll hail this lady, her name was Petra Hunter, and it was written some years ago now. It was one of the best articles I ever read in FX Medicine magazine. And it talked about how even good bacteria processed certain toxins, enabling them to be absorbed by the body. But importantly, they did it slower than the so-called bad bugs. So to me, the practical implication was it doesn't matter whether you've got good or bad, you've always got to keep your bowels moving. And you've always got to keep those detoxification processes moving along with things like calcium-D-glucarate, fibre and everything like that. It's a really important thing to put it in context, isn't it?
It is, yes, and that no one element is going to be enough to really protect someone from the chronic diseases associated with toxicity. And if we are speaking about estrogen-dominant conditions where calcium-D-glucarate is often recommended because of its role in ensuring that healthy estrogen excretion and androgen excretion, we need to also consider the fact that high levels of inflammation in the body are responsible for elevated aromatase activity and therefore increased production of estrogen. So again, that's where the probiotics and ensuring healthy gastrointestinal integrity comes into it, but also addressing any systemic inflammation that may be present.
Well, let's delve into then. What sort of conditions can you use calcium-D-glucarate for if it's not just for gut, if it's not just for the liver sort of detoxification processes? Tell me what conditions you can use it for and what other things would you use it with? So
I would be thinking first of all at looking at certain conditions that are associated with estrogen dominance. So conditions such as endometriosis, uterine fibroids, PMS and other menstrual disorders, they can certainly potentially benefit from the calcium D-glucarate and assisting that healthy excretion of excess estrogen. If women have particularly issues with breast swelling and pain leading up to their menstrual cycle, or during their menstrual cycle, but then also to individuals who are at a high risk of breast cancer and other estrogen-dominant cancers, it can be worthwhile considering as a preventative measure. And as you said, of course, there's numerous other factors that need to be taken into consideration as well. So glucuronidation isn't the only pathway involved in healthy excretion of hormones. So we also need to be ensuring that there's healthy glutathione to ensure good glutathione conjugation is occurring. And that can be done through supplementing with glutathione itself or with N-acetylcysteine, which helps to promote healthy glutathione synthesis. Again, we must ensure the health of the gut. That's an absolute.
Always paramount, isn't it?
It is, for not only ensuring the healthy toxin and estrogen excretion, but also for preventing the systemic inflammation which will stem from a leaky gut, because you get that increased LPS passage and
lipopolysaccharide, yeah.
Yes, and that dysregulation of the innate and therefore down the track the adaptive immune system.
And I might just a little interjection there. It's even specialist gastroenterologists now are sort of embracing the fact that the absorption of lipopolysaccharide from a dysbiotic gut can worsen the symptoms of non-alcoholic fatty liver disease.
Yes.
Really interesting things that's happening here.
And it worsens their prognosis. I remember myself when I first graduated as a dietitian, and I was entering the integrative medicine sort of profession, and I kept hearing this term leaky gut, and I myself was very sceptical about the idea. But obviously, as research has continued into looking at systemic inflammation and its contribution to chronic disease, they've started to realise that this LPS passage through a leaky gut barrier is a truly significant cause of, or a contributing factor at least, to a huge range of illnesses. Depends
what you call it. Some medical entities will not entertain the thought that a leaky gut is an approved term, but they are quite happy to accept the term bacterial fragmental translocation.
Yes, or intestinal hyperpermeability.
That's right. So I think sometimes it's the dialogue that we use and the dialogue that's accepted.
Absolutely.
So what about other tissues like lungs and gums?
Yeah, so we actually find beta-glucuronidase enzyme in a number of different tissues within the body, and also in the serum. And if you do have high levels of that enzyme, that can be contributing to, again, that deconjugation of toxins from its conjugate. And
so sorry to get this clear in my head. Are you telling me that if somebody's a high secretor, if you like, of beta-glucuronidase from lung tissue, that may affect estrogenic type conditions?
It doesn't necessarily have to just be linked to estrogenic type conditions. There's other potential carcinogens and other toxins that are metabolized via glucuronidation. So if we take smokers, for example, they tend to have higher levels of beta-glucuronidase in their system. And we also need to think about, too, that some of the carcinogens or potential carcinogens that are normally metabolized by glucuronidation include the polyaromatic hydrocarbons. So people that are overcooking their meat and having char-grilled meats and all those sorts of things, if they do have that elevated level of beta-glucuronidase, they're not going to be able to efficiently excrete those toxins either. Interestingly, too, the glucuronidation pathway is responsible for the metabolism and excretion of bilirubin. And beta-glucuronidase is actually found in breast milk, and they've even suggested that it's elevated levels of beta-glucuronidase in the breast milk of mothers, which can contribute to jaundice in babies because that bilirubin isn't being excreted then efficiently from their little bodies.
Is there any safety data then that we might have on maybe in breastfeeding, indeed?
There's no safety data that I've seen. It's not to say that it doesn't exist, but I haven't personally seen it. But it would definitely suggest that leading up to pregnancy, it is very important that women are ensuring they have those healthy detoxification pathways. And also, if we want to look at something that we do know to be safe during pregnancy and breastfeeding, they can ensure that they're consuming a high fibre diet, which promotes, again, that microbial diversity and the growth of good bacteria in the gut. They can look at taking a probiotic if they have had a recent prescription of antibiotics that would have significantly compromised the health of their microbiota. There's certain foods that are rich in the calcium-D-glucarate as well that women can consume in order to minimise their beta-glucuronidase levels. And oranges are particularly high in calcium-D-glucarate. So too are apples and broccoli and spinach.
I think broccoli would be the magic thing there, wouldn't it?
Yeah. There's a lot of beneficial compounds in broccoli.
So pregnant women, if you're not going to take a supplement, because we don't have that safety data yet, and I call for any researcher to really look into that. That's an important area. But we can certainly look at nice, healthy doses of broccoli, providing a wide range of beneficial compounds, can't we?
Absolutely, yes.
But again, there's that bacteria. There's so many conditions that if you don't look at the healthy microbiota, you're not really getting all of that linchpin, are you?
No, we do always need to go back to that philosophy that all diseases begin in the gut, and so always address the health of the gut, the health of the microbiota, ensure the consumption of a healthy diet and minimising an individual's exposure to toxins. And then on top of that, look at providing the supplements that may potentially assist with ensuring the health of certain detoxification pathways.
You mentioned inflammation, and I think, again, there's a key thing. So when we're looking at the way that beta-glucuronidase might be upregulated in inflammatory processes, we might be looking at treating with calcium-D-glucarate, but also including that in an anti-inflammatory program. Curcumin, fish oils, exercise, correct breathing. Tell me more about this.
So definitely inflammation is absolutely associated with higher levels of aromatase activity, and that therefore increased estrogen production. So not only do we want to be providing the calcium D-glucarate, which can support healthy excretion of estrogen, we also want to look to what we can do to suppress excessive production of it. So then you're working sort of from both ends to help with minimising any potential excess that's present. And as you mentioned, turmeric is very effective at helping to reduce systemic inflammation. Fish oil at high doses, particularly EPA, are very, very effective. Zinc depletion has even been associated with aromatase excess. So ensuring sufficient zinc is very important as well. And as you mentioned, exercise is incredibly important. They say that sitting is the new smoking because of the risk.
Damn it, and I gave up smoking in 1988.
So the health problems associated with a truly sedentary lifestyle are huge and very significant.
So appreciable dosages, though. I think this has been a real key area that we've missed out on in previous attempts in Australia because calcium D-glucarate, the other name for it is calcium saccharate, and it was added as an excipient in previous products in Australia. But that doesn't give us the therapeutic range, right?
No, so currently, because most of the data is in vitro and animal, it is quite difficult to extrapolate exact effective human dosages. Generally, the recommendation is 1,000 to 3,000 milligrams per day. However, if you do look at the animal studies, they suggest higher dosages may be warranted. They use 100 to 200 milligrams per kilogram of body weight, which really is quite huge. So we are still really waiting for more data to identify specific dosages, but it does appear that 1,000 to 3,000 milligrams per day can provide some benefit. But then, of course, again, I just want to emphasise the importance of not relying on it alone. We must ensure the health of the other pathways occurring in the liver, and we must ensure the health of the gut. We must address that dysbiosis and also look to minimise any inflammation in the body.
Okay, so talking about the pathways of the liver, what other things can you use calcium D-glucarate with, and how would you sway that depending on the type of condition that you might have? Like, for instance, let's say a liver detox for multiple chemical sensitivity versus enhancing that pathway because of hormonal issues like polycystic ovarian disease. What other things would you use with it?
So if we're looking to minimise exposure to certain toxins because of multiple chemical sensitivities, as you mentioned, we'd definitely be looking to ensure that phase 2 is keeping up with phase 1. What can happen in the liver is that phase 1 is very easily upregulated by the presence of certain toxins in the body, and the metabolites that come out of phase 1 can often be more reactive than those that entered. And if phase 2 is not keeping up with phase 1, those intermediate metabolites can hang around and cause some damage. And what we therefore need to do is ensure that nutrient-dependent phase 2 is being provided with the nutrients that it needs. So that's where promoting healthy glutathione comes in, providing the sulfur-containing amino acids to support sulfation, because sulfation is a very important pathway. Generally, if other phase 2 pathways are falling down a little, sulfation tends to be able to assist with picking up the slack. And then also, again, the amino acids are very important for other conjugation reactions. So too are the B vitamins for healthy methylation. So we need to ensure a good nutritional status, and we need to also be ensuring that we're encouraging the consumption of all of those cruciferous vegetables that provide those truly important compounds necessary for healthy phase 2 reactions.
You know, a picture is building in my mind. It's actually quite clear. I'm looking at my mind to some blanched broccoli or broccolini with maybe some asparagus spears, an orange juice to enhance phase 1, and maybe some Parmesan cheese and walnuts over the top of it. You know? And I think if people can start to really enjoy this beautiful food, and I emphasise, like you did, the plant kingdom is the key to so many of these phytochemicals that we can get. And if we can look at that as the base and then add this clinical nutrition components as the tie-off, does that make sense?
It does, yes. And I mean, we just have to look at some of the data from the Australian Health Survey they did a few years ago, and they found that such a small percentage of Australians are consuming the recommended servings of vegetables. I think it was around between 6 and 8% were achieving that recommended daily dose of.
How many percent?
It was between 6 and 8%. I can't remember exactly off the top of my head, but
it's still abhorrently low, isn't it?
Yes, more than 90% of people are not consuming enough vegetables.
I don't get it.
Yeah.
When you can make these things taste beautiful, they don't have to be broccoli. It can be broccoli with.
Yes. Yes.
That's what I think people are missing the key. Where I think people are missing the key.
Yeah. And
so I got you off track. Tell me more.
So basically the cruciferous vegetables particularly are so important for supporting that detoxification. And the beauty is they also provide the fibre that is so important for feeding the good bacteria and therefore promoting the health of the gut. So they're like an all-in-one, and you just have to look at some of the research on cancer prevention. Simply consuming more servings of broccoli or more servings of vegetable per week can significantly bring down an individual's risk of certain cancers. So the smallest changes to the diet can really provide some significant benefits. So if people just commit to increasing the vegetables in their diet, they can really do some profound benefits for their health. But if we move back to talking about those multiple chemical sensitivities, so what we're trying to do is we're supporting that phase 2. So the glutathione, the N-acetylcysteine, the B vitamins, the amino acids, the sulfur-containing compounds, all of those things are essential for promoting healthy phase 2 reactions. Again, the fibre, the probiotics, nutrients that support gut integrity are all very important for ensuring healthy excretion. And relaxation processes can be very important as well, and reducing stress. Because if someone has chronic stress in their life, this can lead to a compromised adrenal function. And when we have compromised adrenal function, we end up with imbalances in cortisol and the body's ability to keep the immune system in check. And as a result, we can get increased intolerances to certain things in the environment. So there's a number of different things that we need to do in order to provide a truly effective treatment or management program for someone who is experiencing those chemical sensitivities or toxicities.
So we're now able to get calcium-D-glucarate on the Australian market.
Yes.
How do you actually practically use this stuff? How do you mix it? What does it taste like? What do you use it with to make it more palatable?
Well, the great thing is that there's not huge doses that are needed. So being in a powder form, you tend to get about 900 milligrams per gram. So 900 milligrams of actual calcium-D-glucarate per gram
That's
of
pretty concentrated.
powder. It is.
Yeah.
So, and then if you think about it, 1 gram being a dose, you're only needing just over 1 gram of powder. And this can very easily be mixed into foods or added to juices or smoothies or just taken on its own. So really the compliance can be very, very good.
So it doesn't taste disgusting? Or
No, it's not terrible. And particularly because it's such a small amount needed, it's very easily disguised.
So I think one of the things is people tend to say powder equals into a watery compound. But what I'm learning from people like Lee Zalchler, and indeed with my experience with other fibre-type compounds, is that you can mix it into more, I'm going to say the word stodgy foods, but that's not what I mean, but things like pumpkin, things like mashed potato. So therefore you can broaden its breadth of treatment to those people that might not normally drink juices.
Yes. I know a lot of people, when they hear the idea of taking a powder, it can turn them off a little bit. They'd prefer to take it in a tablet or a capsule. But the beauty with these powders, when you only have to take such a small amount, is that, like you said, it can be mashed in or mixed into foods, and therefore the individual doesn't even realise they're taking it. One of my favourite ways to do it is mashing it into avocado and putting it on crackers or whatever you might have your mashed avocado with, and you don't even know it's there.
Avocado, the better butter.
Yes. So, and then again, you're having the additional benefit of consuming the fibre at the same time. Yeah.
I think if we can look at the supplements in the context of good, healthy dietary inclusions, and sort of use it with there, it just makes it so much more normal to take rather than this thing out there, the supplement,
Yep, it's just supplementing and adding that extra benefit to your food, really. And I think compliance is often better too if someone knows that they can take it easily and it's not an unpleasant experience for them.
Any contraindications, any cautions, anything that you'd be worried about or concerned about?
So anything that significantly enhances the detoxification or removal of certain compounds should be taken with caution with certain pharmaceutical medications. So particularly the contraceptive pill is a hormonal drug. So there just needs to be that awareness that it could potentially be promoting the excretion of these drugs, and therefore you would potentially exert caution. It seems that calcium-D-glucarate, its activity in the body lasts for about 5 hours. So there is the possibility that you could just separate the doses, take one in the morning and the other in the evening.
Yep.
But yes, generally just monitor that or be cautious.
Yeah, so I think for safety's sake, if you're using it in a lady who's taking, a lady of childbearing age, then it would be prudent to investigate some other form of contraception during that treatment phase.
Yes, so there's no evidence to demonstrate that it will definitely interfere with the contraceptive pill. However, it is one of those areas where we're just not sure, and you are best to err on the side of caution.
Absolutely.
Yes.
Unless you're planning for a family.
Yes.
What about some other hints and tips that you might be able to give our listeners?
So aside from the calcium-D-glucarate's ability to assist with the detoxification and removal of the compounds metabolized via glucuronidation, so those carcinogens and the estrogens, beta-glucuronidase does appear to have other functions in tumour cells. So calcium-D-glucarate's ability to suppress that beta-glucuronidase can be very beneficial because you do have beta-glucuronidase acting within tumour cells. In addition to that, the calcium-D-glucarate has been shown to be anti-inflammatory, and inflammation is one of the key drivers of tumour growth. These studies are in their early stages. They're still in vitro animal studies. However, it is something that is worth considering. Say if someone does know that they're at a high risk, particularly if it's an estrogen-dependent cancer, but other cancers as well. And I think oral cancer and skin cancer, they've shown particular benefit. So that's where it can be a consideration.
So I think as a practical thing with regards to somebody with their cancer therapy, I would reserve it for after the chemotherapy and radiotherapy cycle so that you can then enhance the normal apoptosis of any residual tumour cells that might be there. And I was talking with Lise Alscher about this, and we were talking about how some therapies can actually enable the survival of the more stubborn cells. So this might be something to help turn on or return on those apoptotic mechanisms.
Potentially, and there are a number of different beneficial compounds in plants that have been found to have those pro-apoptotic benefits. So EGCG from green tea, resveratrol, turmeric or curcumin from turmeric. So, there's certainly a number of beneficial compounds that naturally exist in food or that you can take as a concentrated supplement, which can help with normalising those cell death processes, which seem to be not functioning efficiently in tumour development. But definitely, as you said, with chemotherapy and radiation, we need to be very cautious that we're not doing anything which could potentially interfere with that therapy, and definitely reserve it for afterwards for just promoting the health of that individual and assisting in their recovery.
Belinda Reynolds, I love the way that you take stuff and you bring it into practical, clinical application in a safe way. You know, you're really a master at that, and I really applaud you for that. So thank you for taking us through the clinical and practical applications of calcium-D-glucarate and where you should not use it to make it the safest possible adjunct to any sort of therapy that we have for our patients.
It's my absolute pleasure, and thank you again for having me.
This is FX Medicine, and I'm Andrew Whitfield Cook.